is, who is Kayla?
So I am first and foremost a mum. I have two beautiful children, Aston and Violet. They are 7 and 10. I am a nurse, so ex-oncology, currently ED, and I'm also a veteran. So I actually grew up in Tasmania on a little farm, and joined the army when I was 18, for about 8 years. Including a deployment to the Middle East, and then finally decided to go after my dream of being a nurse.
Yeah, wow. What made you originally join the army?
I joined the army to do nursing, and then basically I signed on the dotted line, so to speak, and they said there were no nursing jobs. So I ended up in supply, and then life just kept going, I guess. And then I blinked and it was 8 years later. So
Yeah, wow.
yeah, it was a great experience. Definitely shaped who I am, and I wouldn't change it, but I'm definitely now doing what I was always meant to do.
Yeah, and talk to me a little bit, if you don't mind, about what you've got going on currently.
So currently I have relapse. So I initially had sarcoma in 2020, when I was still an oncology nurse, and went through all of that, and then relapsed in August, almost just shy of 2 years, cancer free. So at the moment, I've just finished my IV protocol, which didn't really work for me. I also had surgery to my lungs to remove some of the tumors, but that also didn't pan out great. So currently I'm on oral chemo every day, which is okay. It's better than IV, but yeah, that's where I'm at the moment.
Yeah, wow. It's a pretty incredible story so far, isn't it?
Yeah, it's a lot.
Yeah, I've noticed as well, I did a bit of research into you before coming onto this as well, and
Yeah.
I was quite surprised about how, I suppose, public you've been with your story on socials, which is really quite remarkable for people in your situation, because there
Yeah.
isn't much research in sarcoma. And the 6 years that I've been on board with the Cooper Rice Braiding Foundation, there's been very limited amounts of people willing to do this. So what has made you want to be that public about your journey?
Yeah, really good question. I guess initially when I was first diagnosed, I didn't want to be at all. I wasn't even sure I'd tell people. But obviously, I was in hospital and away a lot. People kind of, got word. And then I was just really overwhelmed by the amount of concern everyone had. So I started sharing a little bit. And I also joined a support group through Cancer Chicks, which was phenomenal for me. And I posted a couple things on there, and I was really surprised about the amount of feedback I had received, and people asking for more videos and more updates with my journey. I don't know whether it's my type of cancer is so rare, or I'm quite vocal and straight down the line. And I sometimes put a comical spin on things that aren't comical at all, because, like, what else are you going to do? Like, it's a horrific situation. And I guess I really emphasize that it's okay not to be okay. And I think just talking about it makes people realize that a taboo subject can be spoken about. Yeah.
Yeah, wow. And that would be incredibly hard itself, sharing your story, like you said. Has there
Yeah.
been many times where you've wanted to just shut off and shy away from
Oh,
what you've been doing?
100%. I think when I relapsed, I definitely did that. I lost a lot of people in my life because I pushed everyone away. But I think that came into your fight and flight response. Like, I just had my head down and was trying to survive, and that meant I guess, pushing everyone else away. So there are definitely moments that I've been through that, but it's all about getting back up and moving forward. Like, you can feel sorry for yourself and have those days, that's fine, it's normal, but it's all about what you do at the end of that. And for me, that's getting back up. Yeah.
Yeah, well, I suppose it's tough to narrow it down to a few things, but what has helped you get through those really tough times?
I guess my kids, without them, I don't know that I'd fight as hard as I am, but also advocating for rare cancers and sarcoma. Because if I'm not going to do it, if we're not going to do it, like, who is? We just get, pushed back, and there's not enough voices talking about it. So I think that's a big driving force for me.
Yeah, well, and what, I suppose, having two kids
Mhm.
going through it as well with you, what's
Yeah.
sort of been the impact on them as well?
So my son, the first time around, was probably a bit too young to understand. He knows that mummy has chemo, mummy gets sick. Um, he's a bit more clued on now. Like, when I told him I relapsed, he said, "What does that mean?" But my daughter, she's a big thinker, and she definitely struggles a lot more with it. But I think honesty is the best policy with the kids. There's been a lot of research that shows that, but also it's up to the child and the family as to what the kids know. Yeah, and I think it's just about being gentle with what I tell them and how I tell them. But yeah, they're doing all right.
Yeah, well,
They're
there was a
resilient.
there was a quote that I saw on your socials that really resonated with me.
Yeah. I'm like,
Don't
oh
look too
gosh.
nervous, it's all right. The quote is, "You're not a victim, you're just a fighter with scars that few can understand."
Yeah.
Can you tell me what that means to you?
Um, so that means to me, I think it's just so important that people know I am more than the bad things that happen to me. Like, I am not the girl with cancer. Like, I've been through some really horrific things, that have left physical and emotional scars. But that's not just me. Like, I'm a mum, I am a nurse, like, I'm the happy, bubbly Kayla as well. Like, I don't want cancer to define who I am. Yeah.
Yeah, well, that's remarkable. I know I resonate with that quote, um,
Yeah.
and I'm lucky to play sport for a living, but I know
Yeah.
that so many other people are going to resonate with that, and to hear you put in words like that is truly something really powerful with what you're going through.
Yeah, and I think it, shines a light on the mental health aspect as well, cancer or not. We all have our own demons, but you just gotta keep going,
Yeah,
and you're not
absolutely.
defined by them. Yeah.
Yeah, wow. You mentioned before you're in oncology, sorry, and now in emergency
Yeah.
department. I suppose, how does that go and the crossover between your journey and
Mm.
seeing some things that you do on a daily basis?
Um, it can be very confronting. I definitely, when I'm presented with an oncology patient, I definitely need to take a second and make sure that I can handle it and give this patient the best care. But I feel very protective over them. I don't know why. Maybe it's my insight and the fact that I come from an oncology background. I feel like a bit mama bear, like I can advocate for them a lot better than maybe some people without that experience can. And because I'm so passionate with advocating, I definitely kind of jump at my oncology patients a bit more. Um, and I can give them a bit more insight given I've been through the journey myself. So I really love having oncology patients. Yeah, it can be hard, especially when you get the rare one that has sarcoma. But you read the room and you understand whether they need to hear a little bit, that they know they're not alone, or just respecting their journey itself.
Yeah, lovely. And you said that was always been a dream growing up.
Yeah,
What about
yeah.
that was something that you've always wanted to do?
I think it comes from my grandparents. My Nan especially was always very compassionate and caring. There's just never been a job other than nursing that I've wanted to do. From as young as I can remember, it's all I ever wanted to do. And then just happens that both my grandparents got cancer and passed away as well, which is not linked to sarcoma. We know that. But yeah, it definitely pushed me into that field of helping others and being surrounded by hospital staff and seeing all the things that they did.
Yeah,
Yeah.
well, that's a great reason.
Yeah.
I suppose, how has sarcoma changed your life, first and
Mm.
foremost, and then on the back of that, the people around you as well?
I mean, it's horrible. It's a horrific disease. You know, no cancer's good, but it's even more isolating when it's something rare that we don't have any insight to. So even if I did go into remission, this is going to change my life forever because like every lump or bump I get, I'm going to think it's that. Every ache I get, I'm going to think it's sarcoma, it's cancer. And then for the people around me, they've had to watch me suffer. My kids, they've had to grow up quicker than they should have had to. Um, so yeah, it's done nothing. The A silver lining will be that I definitely live every day how I should, how everyone always should. We always say, live each day like it's your last. Um, there's definitely a different meaning when you're literally facing your own mortality. And I guess that's how it's changed for me.
Yeah, lovely. And like you said, we hear that saying a lot.
Yeah.
What's one or two ways that has really resonated with you and ways that you've tried to live out that message?
I say yes a lot more. I've been on more holidays and to more concerts than I've been to in a very long time, in the last 6, 12 months. So yeah, just saying yes a lot more. And it sounds really weird, but even like looking at the sky more, and like the grass literally seems greener, the sky literally seems bluer, like everything's more beautiful. Um, yeah, and I don't think anyone could ever understand that unless they're faced with their mortality.
Yeah, well, it
Yeah.
certainly puts life in perspective, that's for sure.
Yeah, yeah,
I suppose from a charity point of view, we did a campaign video a few years ago
yeah,
now, which mixed with a couple of patient ambassadors and celebrities as well who are close to the
yeah.
foundation. What did it mean to you to be able to see the likes of those people in a video advocating for something so close to you?
I think it's huge. I mean, we look at other more common cancers that have huge campaigns all the time, which is great. But for sarcoma and rare cancers, there's nothing. So I think it's really important to have people that have a following, especially to be talking about issues like this, to shine a light and raise awareness. Because the only way people are going to be more uh, in tune with their bodies and the lumps they find is by thinking, oh, well, I saw such and such talk about that, and oh, my friend has that, and you're going to take more care looking into or following up with appointments and things like that if you hear about it more. Like if we're not hearing about these things, then essentially what's to say they exist? Like it's easy to put things in the back burner, I guess. So it's really good. Any spotlight's good.
Yeah, definitely. And then on the back of that, say, I don't know, there's someone from government or something watching
Yeah.
this. What's your message to those people that have sort of the main decision makings?
My goodness. This might sound harsh, but we're dying. Um, there is not enough funding going into rare cancers, especially sarcoma. But without funding, without more research, without more campaigns, we're not being heard. Um, and it means, if there are less campaigns, there's less education, there's not enough research, we're literally dying. We need to do more. We need to be better at talking about cancers that aren't as common, because at the end of the day, we're still a statistic.
I suppose what are your biggest learnings through all this, and what's some advice that you'd give to either patients going through this or just your everyday person?
I think the biggest thing to take away is that everybody's physical body is so different. So it doesn't matter if you have the same cancer, you're on the same regime, your outcome or your side effects can be completely different because our bodies aren't the same. So if someone is on the same regime and they're violently ill, it doesn't mean you're going to be that way, or vice versa. And I think that's really important to note, because with sarcoma, obviously the outcomes aren't great. So you can deep dive into research and spiral really hard. But I think at the end of the day, you just need to remind yourself that you are different to everybody else. And it doesn't mean that those outcomes are going to be the same as you, because otherwise you're going to be very depressed for your whole journey. And I think it's also okay to have those days where you're not okay and you cry and you scream, and God knows I've done all of that. But it's about getting back up and living your life every single day and raising awareness and doing what you can. Even if you're not raising awareness, like, just get up and try your best to have a good day, do something that you wouldn't usually do. Yeah.
Yeah, beautiful. And I suppose, listening to that, how do you think people around you and people around people going through this can be better, or ways they can help out to that individual?
I think just listening is the biggest thing. There are a lot of comments, especially now I'm on oral chemo, of, oh, you're doing so well, you look so good. But there's no follow-up of, but how are you actually going? Because we can put on a facade that everything's so fine. But I think just, the maybe phrasing words differently, like, is there anything I can do? Or how are you? Instead of maybe statement pieces, is a lot more beneficial to the person, because some people don't want to talk about it. Other people, like me, talking is very therapeutic. So yeah, I think just being gentle and don't tip your toe around people. Like, I think it can be quite damaging feeling like you're wrapped in cotton wool from the outsiders. Just treat people how you vibe they need to be treated, I guess, because everyone, again, is different.
Yeah, beautiful. And it's such an important thing. I remember over my journey, the how you actually going
Yes.
question, especially
Yeah.
living in Australia and our very happy, oh, how are you? Just everyday
Yeah.
thriving.
Yeah. She's right.
Yeah, if someone actually says, how are you actually going? It's like, well, they actually care and have the
Yeah.
time of day to talk to me.
Yeah, exactly. 100%. I think that's the biggest thing.
Yeah, well, I know I've got a lot out of talking to you for 15 minutes. I could talk to you all day about this, and I hope that there's a lot of people that watch this, listen to this, and are able to, one, see what this is all about and sarcoma and the life that it lives and how challenging it is to go through, but also maybe help out in their own way. And is there anything for the everyday person that they could be doing differently for this?
I think my biggest message is check your bodies, because, like, sarcoma, especially soft tissue, often presents as a sport injury, like a torn muscle. So, check your bodies. If there's a lump or a painful area, go get it checked instead of paying it off. Because even as an oncology nurse, I laughed about the lump I had in my leg for at least 2 months, before I got it checked, because I was so fit and active and healthy. I thought it was a sports injury from the gym. So early intervention is key to having a better outcome with sarcoma.
Yeah, perfect. And I suppose hindsight's always a beautiful thing.
Isn't it?
Is there
Yeah.
anything you would do differently, I suppose, throughout your journey or the way that you've thought about things?
The only thing I would do differently is, it's very hard to say because the lump popped up quite quickly. So it would have been quite advanced either way. However, obviously, instead of laughing about it, I would have had it checked sooner. But I think the biggest thing I've done throughout my journey is advocate for myself and question things and push things, which, I've always said, if I look back, I know I've done everything I could have to survive, so that I'm not left with regrets if the worst case happens. And I think that for me, that is really important.
I can't thank you enough for joining me on this, and
Yeah.
hopefully I know it's resonated with me a lot, and
Yeah.
that's why I do what I do, and I hope that it'll resonate with a lot of other people, and it doesn't matter if they're going through the same thing or they're just the everyday
No,
person. I hope they listen to this and take
absolutely.
something away from it.
Yeah, we're here. We need to be heard. We need to be seen. I think that's the key message for all of it. It might, if it saves one life, that's a life, Yeah, education is key.
No, beautiful. Thank you very much. I really appreciate that.
You're welcome. Thank you for talking with me.
Anytime.